Good morning, and thank you to the organizers and Rosalind for inviting us and to actually accommodate my schedule. I know some of you know that up in Albany, it's the Black and Puerto Rican Caucus, and I'm actually going to bring this same presentation up there for the legislators because we need to make change in policy in order to really improve health. Just having treatments will never work. Just wanting good health will never work unless we actually put some policies in place. So I wanted to start out with saying, you know, we built COPE from a community of people who had either had HIV, living with HIV or hepatitis C, or working in the field. And when we saw that there were cures coming out for hepatitis C, we knew the intersection of HIV, hepatitis C, opioid use, substance abuse, and how they all played together. So we looked at the cure for one of these as an opportunity for us to come together and maybe work for 10, 15 years and then retire, right? After we helped our community get cured. If we all bought our ticket to see who's a Kendrick Lamar, and we paid, I don't know, $1,000 for it, and they put the handicapped person in front of us, we all tend to feel some kind of way. So I think that if we could remember that as I do this presentation, we'll see that bias and stigma is not always associated with race. A lot of this comes within our own community that is preventing us from getting better. So let's start thinking about pulling each other up versus how I'm doing versus how you're doing it if you can't do it yourself. Next slide, please. We're going to talk about hepatitis C today, but what I really want to make sure that we understand is there's more than one type of hepatitis. So it's important to get out the way. What is hepatitis? Hepa, right, means to do with the liver. Itis means inflammation. So if you just break up the word, you know if you have any of these hepatitises, you're causing inflammation to the liver. You might not think that that is important because most people who have these diseases like hepatitis C or chronically infected with cirrhosis and hepatitis C, they're still functioning, they're still living, they look like they're having a quality of life. But what we don't realize is that anything that's inflamed can't be working correctly. So our liver is very important to how we live. It has over 500 responsibilities that it must do every single day. So if we don't think that having any of these hepatitis is a bad thing for us, we're going to probably learn a little differently today. The most common hepatitis are A, B, and C. Currently, we have vaccinations for A and B. Interestingly enough, B was not a common vaccine for us up until the mid-80s. At that time, I think the United States had come to see that immigration had exceeded 70% of those who had hepatitis B, and they started to understand that we're going to interact with each other. I'm sure some of you have had kids that were sent home from school eventually because they didn't have their hepatitis B vaccine because they didn't have to have it when they were born. It was something that came about. The good thing is the hepatitis B vaccine is actually a really good vaccine. If you take it, it's 3 shots over a 6-month period, and it lasts for 20 years. So even if you've had it when you were 20 years old, some of us are living to be 60, we need to go get those titers checked. You know, we start out, all of us supposed to know where our organs are, how many we have. But I remember when I first started doing this, people thought we had 2, the liver repairs itself, and that's all they knew. So why did it matter if it gets something like hepatitis? But all of that matters. If the liver is supposed to be smooth to the touch and look like something we might want to eat, and then all of a sudden it looks like coral from the bottom of the ocean, they can't possibly be doing the same things. In correcting itself, the repairing is actually what's causing the scarring. So the work that the liver is doing to take care of itself is actually damaging it over the long haul, and it won't function. And we need the liver to survive, even for our medicines to work, to break down everything, to digest our food. It just never stops. And one of the things I appreciate the liver is I'm usually tired around 2 o'clock, and I think my liver figured it out, and it goes, okay, let me convert some of this to energy and spark her back with energy. Most of you don't even know you have hepatitis C because you're used to being tired. You're used to being foggy. When you get cleared of this disease, you realize that you were carrying something that felt like a backpack on your back. So if you haven't been tested, please get tested today because you need your liver. Next slide. So how do we get hepatitis C? One of the reasons that there's so much stigma associated with this is the first thing you're going to hear about is IV drug use, using substances, something that people just don't automatically raise their hand. So if I said everybody here should get tested because this was a disease for people who use drugs, would anybody just jump up? 9 times out of 10, they don't. It's one of the reasons we had such a hard time with women and blacks in general around HIV, because when we asked you to test, we were saying to, who did you sleep with in the past 6 months? And that's personal, and that's something people don't want to share and certainly don't want to be judged by. But in the process of keeping that what we call secret, we damage our existence to have some kind of quality of life. Well, I'm here to give you all some plausible deniability on how come you should be tested. Most of us were born before they were screening for hepatitis C, which means we probably came into contact way before we knew it. And if you don't believe me, you've been to the dentist now and you've been to the dentist 20 years ago. What's the difference? They used to open up the whole container to fill your teeth, get something out, swoop it on the table. You go to the dentist now, everything's covered. Everything's individually wrapped. Were you just as secure back then as you are now? So if you've ever been to the dentist, blood is one of those utensils. Blood of hepatitis C does not die just because you don't see it. And I totally want to know what's in the blue jars in the barbershop. Does that really stop the blood from the nicks from each of you guys? I stopped taking my boys to the barbershop the day before Easter, right? They were cut up from the whole side of their head. The thing is so hot, they spraying it. The nicks, right? These are all ways in which we were exposed, and there's tons more. You've ever had surgery. Do you notice that our population of hemophiliacs have gone? They died of cirrhosis of the liver before there was a cure, before there were good treatments. We want to protect our liver, and we don't want the idea that this is associated with drug use to be something that keeps us from taking care of ourselves, especially in the black community. Guys, if you live in a community like Harlem, why are you feeling any stigma? If it's happening here. If you live in the Bronx, 40 out of 100 will come up positive. Right here in Harlem, potentially 4 in 7 black men. So, yes, it's an issue, and we need to address it, whether it is associated with IV drug use. And let me tell you something, most people have been exposed to IV drug use, whether they know it and remember, because remember what we learn now, the cooking utensils, all the things. What if you had someone that was using in your life and you washed their clothes? You don't even know if you got stuck with or touched something. We've learned a lot about the hep C virus. We've learned that science shows that it lives anywhere from 5 to 21 days outside of the body, post being wiped up. So anything that had blood on it from an infected person, and you, because it's a blood to blood direct. This isn't semen, this isn't breast milk, this is blood to blood. So most people, once they learn about this, probably wouldn't have did the blood sisters, right? If this was something we knew about when we were kids, we probably wouldn't have all been doing that. Mother to child, having procedures, and if you are HIV positive, most of these things travel together. Next slide, please. Oh, just really quickly, the baby boomer, people always say to me, why this population? What was going on in that time was people came back from the war and started having kids. People came back from every war and started having kids. One of the main places that these diseases were rampant and known and called non-A, non-B because they couldn't really figure it out, but yet, no mobilization towards awareness, screening, because the way in which this was seen was this was a population that was marginalized, or potentially people didn't want to deal with something like this. So this is probably where COPE began. When we saw that there was treatment, because most of us, we're going to talk about a lot of diseases, and most of things are not perfect. So I'm sure with cardiology, we have great, lipid-lowering drugs and great procedures to put stents in, but not everything's perfect. So just because you have good science and good medical stuff, you need the entire system to hold up to its responsibility. And we, as a community, need to hold up to ours. And what that means is when the drugs came out, I know there was a lot of hoopla about how much it cost. 70% of New Yorkers are on Medicaid. I didn't care how much it cost. I wanted the 150,000 who had it to be cured. You see, that was the difference. A lot of us were worried about how much it cost. It wasn't even something that we should have known. Why was it told to us? Do you know how much every drug costs? But that was for this population. Right? So we got to tell everybody, this is $1,000 a bill and it's out of your tax dollars and it's for this particular population. So that even you might have had, remember the equity, equality, right? Like, what? That's who we're going to give this to? They're testing where they believe it is, but that doesn't necessarily mean they're being proactive. So how do we change that? Is we get everybody to do what it is that they're responsible to do. Next. This to me is embarrassing. Although there has been an updated slide, this is our country. This is how we responded to it. We know that there's an estimated 3.5 million people, but guess what? In the black community, we should never accept anything that comes out as an estimate, because let me tell you who they don't identify. Housing shelters, people in prison, they are not counted. If you knew that, what would you add to the number? Because we know our community was left out of the numbers, at least a great percentage of them. So, as a country that has a cure, something that has limited side effects with a short duration of treatment, we have not even done a good job, and it's been 10 years. Well, 8 years since we've had some without the injection, which was the bad part of the drugs in the past. And so, if you look at this and you said, we know that 3.5 million have it, but we haven't even confirmed that as a nation. We only confirmed about half of it as a nation. So if someone has an antibody test of Hep C, as a provider, it is your responsibility to call them in and get a blood draw to make sure you confirm whether they actually have the virus or not. And that's important, because everybody who has the virus doesn't go on to progress, but certain people do. People who have these other chronic diseases that we're going to talk about today certainly need to make sure that they don't have another problem, because it's going to prevent them from being okay. So we all are willing to concede that HIV tore through this community and devastated us. And we are willing to say that it wasn't a good thing, and maybe we're going to recognize that we should be tested, not judge people, and just do whatever it is to get people aware in treatment. Because now, people with HIV, if they're doing the right thing, believe it or not, sweeties, they are going to live longer than the most average person, because they're being touched by medical care on a regular basis, and it's a comprehensive model. So who else is dying? The other diseases. And what are the people with HIV dying of? The other diseases. Who knew that they'd live long enough to die from other things? So, if you think HIV is a problem, look at the devastation of Hep C and when we saw it impact our community. If you look at 2006, that's exactly when we noticed that HIV was also a black disease, especially of women. So that's a significant turning point. Next slide, please. So African Americans specifically. You know, I remember, everybody knows Charlie Rango, next slide, everybody knows Charlie Rango. And I remember when the HIV epidemic first came out, you gotta love him. We go in and we're like, Charlie, you know, this is a bad issue. He says, you don't have to tell me. If it's out there, that's where I get it from. I know it's in Harlem, right? So we're used to hearing how disproportionately we're impacted by a disease. I'm sure everyone's going to get up here and say the same thing. Blacks represent 13%, yet we represent some, right, outrageous number of that particular disease, right? This is no different. What is different is we're two times more likely to not be screened, to not be treated. I didn't know anything that had a cure. I've been alive 58 years, so this was exciting for me, especially something that could cure 5 to 10 million people in this country. Next slide. So this is the part that we need to all realize that we need to be tested. You know, my brothers, my men, you know, believe it or not, I know we often say that men don't take care of themselves. It depends on what it is, right? right? Because if it has something to do with certain organs, they take care of it, right? So I'm here to tell you that you don't even know that your libido is affected by Hep C. At COPE, when it started, we didn't have any outreach money. We didn't have no social media. All we did was cure one black man, and he was able to perform. He told 7 other black. We were like, yes. And he said, I don't have to buy Viagra no more. This is serious. I didn't know that, right? That wasn't something I could tell him about. But you know what it is? To relieve the fog, to get energy again, to stop the scarring of your liver from just going crazy. It does something to give you some quality of life, which makes you excited. Like maybe you're not tired by 7 o'clock at night, so that's why you're really performing. So those are the things. Black men in their 50s, 1 in 7, and that depends on where you live. So if you live in the Bronx, this is really probably like 4 and 7. In some areas in Brooklyn, Far Rockaway is really bad. Mount Vernon, why? Where do we send people? In shelter, right? So if you follow where housing and you know, places were set up, then you'll start to see. Because I remember telling the woman from Far Rockaway how many people she had in her area. She was like, excuse me? She didn't even know there was that many shelters out there. And now Mount Vernon is the closest place to New York that takes Section 8. So if you look at, and then in Mount Vernon, they're not going to get the same services they get right here in New York City. So as they leave to get a housing, they lose the benefit of some good resources in New York. It's a crazy thing, but we have to remember this, next slide, so that when we're talking to a black man over 50, we just have to ask, have you tested? And don't let them tell you, yeah, I got a good doctor, you know, me and my doctor, yeah, I know, because it doesn't work that way. There's no reason to test you for Hep C, they won't test you. So they gotta know you had a history of this, you were in the military, you know, you did this. So, we often don't get referred to specialists. So 90% of them come in, they got a history of incarceration or a history of substance abuse, or whatever the issue is, the guy just feels like he's durable, he's okay, the treatment wasn't good. That's the old story. Now that the treatment is good, what happened to the referrals to the specialists? And I love my community, but Harlem Hospital, if you wanted an appointment with a specialist, it'll be 4 months. Mount Sinai will see you tomorrow. So we have to look at how we want to receive our services, where we can get what we want. And that's what an organization like COPE will do. It'll be like, don't be thinking you want something that's not going to give you what you need in a timely fashion. What we have to do is help advocate for Harlem Hospital, understand this is our issue, because they have like a clinic, no providers, because it's like everybody's going to prioritize something different. But we have an opportunity here, and this is something in our community. I guarantee you Columbia will open up a panel to treat us. So, and if you guys are from there, it's not a negative. It's more like, how do we also take care of ourselves and hold our institutions that say they're about us, for us, to it. And I love Harlem Hospital, and Joan Culpepper Morgan is the head of the hepatitis, and she'd be happy that I said for you to contact them and say, open up some panels, open up some doctors, right? Get some people in there so she can help treat people for hepatitis C, because that's where they want to be treated. Sometimes they want to wait for that 3 months, and then you lose them. And then it starts all over again. So this is important that we take care of ourselves, because we don't want to get liver cancer. And that's the next stage. So what about Hispanics? What about Latinos? Let me just tell you, our brothers and sisters in the Latino community, they may not have the same prevalence, but they die a lot quicker, because for some reason their genetic makeup already gives them fatty liver. If you notice, even if they're not overweight, a lot of them have diabetes, right? There's some stuff going on genetically, so they have some stuff happening in their liver. So if they get hepatitis and they drink, right, it's almost like the expiration is speeded up. So if we have Latinos not being treated and cured, we don't even know sometimes that they had hepatitis, they just died of cirrhosis. So we have to really do a good job, not just of blacks, but of our community, because we interact with each other and we marry each other. And you know, I remember when I was growing up, we wanted to fall in love and marry someone from our community. With this data, I tell my daughter, go to North Dakota or something. You know, it's like, you know, 1 in 5,000, you know, so it's the truth. If you want to have unprotected sex, look at the data. And then say, here's where I'm going to have it at, because there's not going to be many places left. Next slide. So, access is a barrier, and now that the Affordable Care Act is almost like under attack, and I know Black Health Matters is gonna, you know, do a lot of advocacy to continue to make sure that things that were afforded to people during that act still happens. But if you wait for your government to do it, it's not gonna happen. We are less likely than whites to be tested, and guess what they don't prioritize from a federal level? Screening, because they figure you all in care, you all should be getting screened there. So there's not a whole bunch of money now. They'll have a bunch of money in the drug treatment programs where, oh, that's the higher prevalence. But what about our greater community where we're all not in drug treatment programs? Right? But our history and our background and our families need the services. So we need to make sure that we talk to our legislator. What are they doing? Do they know about the Hep C? Are they making sure access is here? Next slide, because here's the next two slides are really interesting, because hepatitis can be cured, and to me, that's where you start the conversation. So everything after that is they're saying, but, right? It costs, but what? Right? This is like an opportunity. Next slide. So what the government did was it just put out a national response of information. Okay? And they had something called the action plan. Next slide. So this is, again, what I really want to say about our community. We can't wait for someone to come and save us. The best drugs in the world started coming out at the end of 2013, and there's still one person in charge of this plan. And they've assigned, next slide, one person in some states called the viral hepatitis coordinator. Okay? And then really they hoping she connects with you and you help her do this stuff. Next slide. So these are just not really a great picture, but these are just things that I like to recommend. Sometimes people don't know what they could do. But you know, the Affordable Care Act gave us a chance to help, you know, New Orleans get some access, right? And as soon as the cost became an issue, what happened in New Orleans? Even the Affordable Care Act couldn't help people get access. They have a grade of F. They haven't treated anybody. The best state in the country at treating people is Connecticut. Well, who has the most baby boomers? You know, I think some people take it. New York State only treated, they're not even in the 50% range. But this is New York State. We love it. And you probably want to be here rather than other places. So I'm not knocking it. It's more like, let's hold us accountable. Next slide. So as I was talking about before, this is the problem, but the number of annual hepatitis C related deaths are exceeding 19,000. What should also be on this slide is there were 19,000 new infections last year, and none of them were older than 36. So whereas this was a baby boomer disease, now with the onset of opioids, people going back to IV drug use, because, you know, Oxycontin costs $10. You can get a whole bag for $10, you know, so it's like people then do other things, even if they didn't start out this way. And even people who are baby boomers doesn't necessarily mean they inject it all day, every day. That was their life. I remember when people used to skin pop. I remember when that was some things that we did. So it wasn't like you knew you were exposing yourself, you were just dipping and dabbing. And some people just got it from that instance. But the deaths and the new occurrences is enough to be scary, especially when I told you at the beginning of this is we're not screening people and we can't see it on utensils. We can't see it in the barbershop, in the tattoo parlors, in the nail salons. Please don't leave your kids in that nail salon and stuff like that. And you know, it is your right to tell them to clean it up, to ask them how they clean it. It is your right. I walk in these places and I'm thinking, I want to just tell everybody, run for your life. But, you know, people don't invite me to parties anymore, so I'm trying to, you know how I used to eat the peanuts off the bar? I'm like, no, thank you. But it's just those kinds of things. There's so much bias, there's so much stigma, and you know where it starts? With us. The churches, we had to put a whole bucket of money into black churches just so we could talk about HIV to our own people, about our diseases. Like, really? Let's hold people accountable. It's all about, when we leave church, we from this community. And this is why I want church leaders to be involved in this stuff, because they will be called to the table, not me. Right? When these issues come out, I want him to know what I know so that he'll say, hey, we need this stuff. They're sitting on boards and stuff. They have the ability to be educated. I understand what God says, But what's in front of us is important too. And what's in front of us is helping people if we can, and using what we know to share. And if all of us are gonna see Black Panther, and if all of us know the history of us, how did we survive? We shared, we told, we explained stuff. We didn't judge people. That's what's stopping us. I don't care what the doctor feels, because I can make him eventually do what he has to do, right? It's how you make us feel if we have this that makes us want to get better or not. So you should go home and say to everybody, hey, we're all getting tested. I don't care why, because we've all had a tattoo, we've been exposed. And here's one of the favorite ones that no one admits to. Whoever shared a toothbrush? Nobody admits to that. I say you've never been in love and went away for the weekend and forgot your toothbrush. That's what I say. But it has happened. And it doesn't make you bad, it makes you in love. And it could have been a bad decision, but you cared at that moment. And so now, 10 years later, you're gonna judge me for that? Did I even know? So that's who has this disease. Failure to provide it is gonna threaten the health of the most vulnerable. This is our most vulnerable population. And if you look in the shelters, my God, it's almost too many of us to be, just leaving this issue unattended. Next slide. I can show you the same slide in another color and say we have an opportunity, because we know where the majority of the people are who have it, because they're in some kind of program. They're in, even if it's a senior center, even if it's a primary care doctor's office. Sometimes people know they have hepatitis C, but maybe they're still drinking. Maybe they're unstable. So you know what? I don't want to give them the drug because I don't know where they're going to be. That's not your call. You call an organization like COPE and you say, help me. I got somebody who needs treatment. How can you help me help this person get what they got to get? That's how this works. So next slide. Here's another opportunity. We know 1/3 of the people with Hep C are living in the HIV community, the most well-resourced disease I've ever seen in my life. Do you think everybody's cured who has HIV and Hep C? That's an opportunity. Next slide. People have never even been screened. We're saying, who is the population? So if there's a guy who's been in the military, been in prison, been in a shelter, may have received suboptimal care, may have shared a needle, how come he's not screened? How come she's not screened? Somebody's swiping their Medicaid card for something that day. I guarantee you. Next slide. 1 out of 2 patients with Hep C report psychiatric or some kind of, mental health issue. So again, opportunity. If I was treating them, I might actually get them to take care of some of the other things, or I might recognize it, or get them diagnosed. Next slide. Maybe that's why they haven't taken care. Maybe that's why they're still using. So we know that substance use is huge, but it doesn't necessarily mean active users. We know that that's a huge population that has it, but you know what? They actually know how to access services better than most people. So don't sleep on them. They have the doctor every time. They know how to use their card. Now, it's about other people who, don't take care of themselves. And I think what happens with them is people say, you're all right, you're all right, you're all right. And, hopefully they'll be on someone else's insurance next year. And then they can get treated. That's how the insurance companies think. So 29,000 new infections just in 2013 alone. Next slide. And they were 8 out of 10 had reported to have a history of injecting drugs. So again, we don't have a syringe exchange in Central Harlem. A lot of us may have a lot of feelings about that, but the data is real. That syringe exchange reduced the spread of HIV, hepatitis C, and actually, gets people to not have an overdose. So like if we were managing the philosophy and the policy, maybe we'd have more understanding of how to use it to better service our community in a positive way. Because I'm not saying we should or we shouldn't, I'm just saying we should have an opinion, and it should be a knowledgeable one, instead of other people coming to open them up in our community. Because the data says they should be. So I talked a little bit about this. here's an opportunity. So now Long Island politicians may be interested in passing some good legislation around opioids, right? Around these issues. So let's take advantage of this opportunity, because this is affecting whites, and most of the new infections were not in places like New York, but in Indiana, right? And places where people are much more concerned about this young population, right? So we could use this as an opportunity. Next slide. This is just, you know, we have a new Attorney General. He's even better. I should have updated his quotes. He was actually in Indiana when they had the outbreak. He's now the U.S. Attorney General. But this other guy was saying, you know, if we just have some compassion, we probably would have already cured people. But because people had some kind of feeling, when the cures dropped, we weren't all excited about taking care of this population. Right? If it was cancer or a cure for HIV, it would have been a whole other story, because the people who lead the charge, they're not primary. So if blacks are not taking charge on this issue, then someone else is taking charge on this issue, and they're able to tailor it to meet the needs of what they think is important around this issue. Did I say that? Okay. Okay, next slide. So how do we give patients a chance? It's so simple. That's why I really wanted. I've been working hard for 30 years. I'm a social worker. When the cure came out, I was thinking, Jesus, this is it. 10 years. Let's start code. I'm gonna get some people cured and I'm gonna retire. Next thing I know, restrictions, bias, stigma. It was just ridiculous. And all you had to do was say, hey, Joe, let me draw your blood to make sure you have hepatitis C. If you do, let me take you to this doctor. Hey, doc, I got Joe. Don't worry about Joe. Just write the prescription, and we're going to get him cured. Very simple. Then I support Joe for the 3 months and educate him so that he doesn't put himself at risk again. That's how simple this is. No side effects. 1 pill a day or 3 pills a day, 8 weeks or 12 weeks, and Joe has insurance and a doctor. Why isn't it happening? Next slide. So, what might a cure mean to people? I mean, why would this matter? Next slide. It matters because you get your life back you didn't even know you were missing. And if you walked around for the last 20, 30 years with HCV, that's what it's called, hepatitis C virus, and the doctor told you don't worry about it, because remember there wasn't good treatment back then. You're gonna live as long as you were gonna live anyway. I guarantee you he did not tell you stop drinking, stop eating fatty foods, lose weight, diet, exercise, because what will slow down the progression of the scarring and the cirrhosis is your behavior and your lifestyle. Right? So even if you get something, you play a role in whether it takes you out, when there's good stuff to take care of it. So join organizations that help you, because we live in a place like, you know, look where we are. Everybody wants to be here. But when I start talking about the data, nobody's like, that's why I'm not invited to the party, because I'll be like, yeah, Harlem is great, but let me tell you about the, they're like, oh God, you know, yeah, you could go eat at the nice restaurant and hear jazz and look at the beautiful women and men and look at the history, but you gotta, you know, you can't sleep with anybody. Next slide. So this is who we are. And like I said, we're on 125th. And thank you for acknowledging my HEPS universities. I'm not always creative, but I really felt like the way to reduce the stigma was to bring these leading thought leaders around hepatitis and liver disease to meet my folks in my community, because you know, they first don't want to do the talk for me, and they'll go, well, you know, I only have 30 minutes and so then they be going, oh, Gloria, I really love you guys, man. If they see any of my guys on the street, they wouldn't have said that. So now they all know each other. So now if I want to go to this doctor, he's not judging me. And I'm not thinking he's going to. That's one of the models. And so it helped doctors stop looking at my patients as them and those people. We actually knew more than most doctors about hepatitis C. So they were like, what? I like these people. So once I educate you, you actually now know more than 75% of the country about hepatitis C. So give yourselves a hand. Wow. So now you're empowered to do whatever you want. If you want to take care of yourself, take care of your community, get better at your job, Hepatitis C is also an area that you should probably look in if you're somebody living with chronic disease. This is where we want people to go out and educate other people. So I want to say thank you so very much. We are testing here today. It's free. If you don't want to do it today, you can do it tomorrow. You know, just call us. Please don't deny yourself the right to know, the right to help, and the right to help cure the community. Thanks so much, guys.